High blood sugar can quietly damage your nerves, eyes, and kidneys, often long before you even know it. The scary part? Your body does try to warn you. Most people just don't realize it because the signs feel so ordinary. Here are 10 early red flags you can't afford to miss, starting with one that shows up while you're asleep. If you're waking up more than once a night to use the bathroom or keeping a water glass by your bed, that's not aging or hydration. That's your body trying to flush out excess sugar. When blood sugar rises, your kidneys step in to protect you. They push that extra sugar into your urine, and sugar drags water with it, so bathroom trips start to pile up. That's called osmotic diuresis. You don't just go more often, you pass larger amounts, and your urine may look pale or almost clear. This affects up to half of people living with diabetes, which is why it's easy to spot but just as easy to shrug off. Many people blame tea, coffee, or a new water bottle. The giveaway is timing and volume. Waking up to pee once in a while is common. Waking 2 or more times most nights with big outputs points to glucose. If you also refill your cup right after you go, your body is chasing losses, not just flushing caffeine. For many, this creeps in over weeks to months, so it gets overlooked. Ray started getting up twice a night and keeping a spare water glass by the bed. His fasting glucose, 154 milligrams per deciliter. Persistent daytime polyuria plus nocturia often travels with high sugars. Medical cutoffs to keep in mind. Fasting glucose at or above 126 milligrams per deciliter, or a random reading of 200 milligrams per deciliter or higher when symptoms are present. Here's a quick home check to sort hydration from hyperglycemia in 24 to 48 hours. For one day, log every drink and every bathroom trip with approximate amounts. If you're urinating every 1 to 2 hours with clear, high volumes, or waking 2 or more times at night, test your glucose and call your clinician. And if you notice you can't seem to quench your thirst afterward, there's a reason. You drink, and minutes later you're thirsty again. The twist: your cells may be dehydrated even while you're sipping all day. Here's what's happening. When glucose runs high, the kidneys can't reabsorb it all. Sugar spills into urine and pulls water with it, leaving you drier inside. Your brain reads that dehydration and drives polydipsia, strong, persistent thirst. You keep drinking, but the fluid exits fast, so the cycle repeats. Along with polyuria and often increased hunger, polyphagia, this sits in the classic 3 Ps of diabetes, a recognized pattern, not a random annoyance. Many chalk it up to salty food or dry air. Those cause short bursts of thirst. The red flag is thirst that doesn't fade even when you hit a normal intake, especially if you're also peeing a lot. Waking at night to drink is a clue that your body is trying to replace fluid losses from glucose-driven urination. Anna carried a 32-ounce bottle everywhere. She hit her water goal daily, yet her mouth stayed dry and tongue felt thick. That cotton mouth feeling links to higher serum osmolarity when glucose pulls water out of tissues. Persistent thirst with frequent urination is a classic symptom cluster of high blood sugar. Here's a simple home threshold. If you're drinking about 2 to 3 liters per day and still feel parched, or you wake to drink at night, it's time to check a blood glucose. A random reading at or above 200 milligrams per deciliter with thirst and urination needs prompt evaluation. When fluids can't keep pace, other senses start to signal too, sometimes in ways that make daily tasks suddenly harder. Now to your eyes, specifically blurry vision that seems to appear and fade without warning. If your glasses seem to go out of date in a week, it might be your glucose, not your prescription. When blood sugar runs high, fluid shifts in and out of the eye's lens. The lens swells, its curve changes, and light no longer focuses cleanly on the retina. That shape change blurs vision, often in both eyes, and it can come and go over days. As glucose returns toward your usual range, the lens deswells and focus improves. This kind of blur is usually temporary once sugars settle. Many people book a fast prescription change. The better move is to steady your sugars first, then check your eyes. If the blur lingers despite better control, you need an exam to rule out damage in the back of the eye. Diabetic retinopathy, damage to the retinal blood vessels, is the leading cause of blindness in working-age adults, which is why timely eye exams matter. Urgent warning signs include new floaters, flashes, a dark curtain over part of your vision, or eye pain. Those need same-day care. Here's the distinction that matters. Temporary blur comes from the lens shifting with glucose swings. Retinopathy is a different process that can threaten sight over time. Try a 3-day home experiment. Note what you eat, check a glucose reading 2 hours after meals if you can, and rate your vision from clear to blurry morning and evening. If blur tracks with carb-heavy meals or the morning after high readings, stabilize sugars and book a dilated eye exam, then evaluate how your energy feels the rest of the day. Now let's turn to how high sugars drain your stamina, fatigue that hits hardest when you need energy most. If you're falling asleep in the chair by 3 p.m., it may be low energy in a high-sugar environment. Here's why that happens. With insulin resistance, glucose stays in the bloodstream instead of moving into muscle and brain cells. Your cells feel underfueled even while your meter reads high. The result is heavy eyelids, foggy focus, and a slump that shows up after big meals or long stretches at a desk. You might blame age, poor sleep, or stress, but the tell is timing. The crash hits after a carb-heavy lunch or when you've been sitting for hours. Fatigue is a hallmark symptom in diabetes, and while the exact biology is complex, mixing insulin resistance, inflammation, and hormone shifts, the pattern is consistent. Dehydration from frequent urination can stack on top, lowering blood volume and worsening that drained feeling. Marta napped after lunch daily. A 15-minute walk shifted her post-meal glucose down 30 points, and her nap disappeared. That pattern matches what we see again and again. When the spike shrinks, energy returns. Post-meal highs sap energy because fuel isn't entering cells efficiently, and inflammation rises just when you need to work, drive, or focus. Try a quick self-test that can change your energy in 48 hours. For the next 3 days, start a 10 to 15-minute walk within 30 minutes after each meal. Keep the pace brisk enough to warm you up but still able to talk. Note your energy at the 2-hour mark, and if you have a meter, record a 2-hour post-meal glucose. If your fatigue eases and your readings drop, bring those notes to your clinician. And if that afternoon crash rides along with a growing appetite soon after meals, there's a related signal to watch for next. You eat, feel full, then hunger returns fast. The signal: plenty of sugar in the blood, not enough inside your cells. That pattern has a name: polyphagia. When insulin isn't working well, glucose stays in the bloodstream and doesn't reach cells efficiently. Your body reads that as an energy shortage and turns up appetite, even when your meter runs high. Alongside frequent urination and constant thirst, it sits in the classic 3 Ps of diabetes. The result is quick hunger after meals, grazing through the afternoon, and late-night cravings that keep the loop going. Many people read the urge as a call for more carbs. A muffin or juice can calm hunger for minutes, then spikes glucose higher and brings hunger roaring back. That short relief hides the real issue: poor fuel delivery to cells. Slowing the glucose rise and improving satiety helps break the loop. Research shows low glycemic, higher protein breakfasts tame post-meal glucose and reduce late-morning hunger. Fiber adds bulk and slows digestion, so glucose enters the blood more gradually and cravings ease. Try this for the next 3 days. Instead of cereal or toast at breakfast, go for eggs, Greek yogurt, or a veggie omelet with some berries or oats on the side. Add a handful of nuts or seeds for extra staying power. Then pay attention to when hunger hits. You may find that balanced meals keep you full longer and your glucose more stable. If hunger still hits hard, especially alongside high readings, it's a sign your body isn't getting fuel where it's needed. That's when it's time to talk with your clinician about adjusting nutrition, activity, or medication. Then pay attention to the next body signal that can show up when sugars run high. Pins and needles that won't quit are not just a circulation quirk. They may be your nerves calling for help. Here's what's going on. Chronic high blood sugar bathes small blood vessels and the thin insulation around nerves in a sugary environment. Over time, that harms blood flow and the nerve's ability to carry signals. The longest nerves take the hit first, which is why symptoms usually start in the toes and fingertips before spreading upward like a sock or glove. Diabetic peripheral neuropathy affects up to half of people with diabetes, and symptoms often build slowly, which is why it slips under the radar. Early signs include tingling at night, a burning feeling when sheets touch your feet, or a numb big toe, often before obvious pain. Some people feel sand in the shoe, others notice balance getting shakier in the dark. It's easy to shrug off until drops, trips, or sharp zaps make you pay attention. Donna kept dropping her keys. A monofilament test in clinic showed reduced sensation. Her A1C was 8.3%. Tightening glucose targets help slow progression. In early detected type 1 diabetes, tight control can cut neuropathy risk by as much as 78%, while in longer-standing type 2, the benefit is smaller, around 5 to 9%, but still meaningful. Routine foot checks also lower the risk of ulcers. One more wrinkle: long-term metformin can lower vitamin B12, and low B12 can worsen numbness, so it's worth checking. Do a quick home screen once a week. After a shower, dry well and inspect soles and between toes for cracks or blisters. Lightly touch a cotton swab on each toe and compare sides. Test warm versus cool with 2 spoons. If changes persist, ask for a neuropathy exam, B12 labs, and a plan to stabilize sugars, because when sensation dulls, even small skin breaks can linger. A small nick that drags on for weeks is more than annoying. It's a blood sugar clue. Here's why wounds stall. High glucose slows your frontline defenders, white blood cells, so they react weaker and later. It also thickens blood and stiffens small vessels, bringing less oxygen and nutrients to the injury. With fewer immune cells arriving and slower circulation, cuts linger, scabs break down, and infections get a foothold. People often wait it out, thinking it will close, eventually. Meanwhile, bacteria and fungi love sugary environments. Even a mild scrape on a shin, a toenail edge, or a razor nick can turn red, warm, and oozy when glucose stays elevated. Moist skin folds and tight shoes add friction that keeps the cycle going. Blood sugar control is one of the most important factors in improving wound outcomes. Bring levels down and the immune system and repair phases work better. Research shows that higher A1C impairs neutrophil function and delays the repair phases, while early care prevents ulcers, especially on the feet. Use a simple home protocol. Rinse with clean water, pat dry, then apply a thin layer of plain petroleum jelly and cover with a clean bandage. Change it daily, keep pressure off the area, and note size, redness, and drainage. Mini payoff. If redness spreads, pain increases, there's pus, fever, or no improvement in 3 to 5 days, seek care and check glucose. Ask your clinician about a foot exam and infection screening, especially if cuts recur. When infections return despite care, your body may be drawing fuel from the wrong places, and the scale can start to shift without your permission. Now let's address another early signal that can catch you off guard. Losing weight without trying may sound good until you learn what's being burned. When insulin is low or not working well, your cells don't use glucose efficiently. To keep you going, your body taps stored energy. First, it breaks down fat, then it pulls amino acids from muscle. That means the number on the scale drops while strength, stamina, and balance quietly suffer. You might notice looser waistbands, but stairs feel harder, jars are tougher to open, and recovery after a walk takes longer. This can show up in both type 1 and type 2 diabetes, though it's more common in type 1, and it often travels with thirst, frequent urination, and fatigue. There's a cost to that loss. Less muscle lowers your resting metabolism and worsens insulin resistance, which can push glucose even higher. That creates a loop: higher sugars, more breakdown, more fatigue. It can move quickly in weeks, not months, especially when other symptoms are present. Here's a quick way to tell healthy loss from a warning sign. Ask yourself, did you change diet or activity? Are you hungrier, thirstier, or using the bathroom more? Check morning weight twice weekly for a month, and note strength tasks, like rising from a chair without using hands. Mini payoff. If you lose more than 5% of your body weight in 6 to 12 months without trying, or any significant unexplained amount, check a fasting glucose and A1C. Add 2 to 3 days of resistance exercises, aim for protein at each meal, and schedule a visit to review medications and nutrition. And when sugars run high, certain infections tend to return. Let's zero in on a pattern many people find uncomfortable to talk about: recurrent yeast infections, as when itching and irritation keep returning, glucose might be feeding more than your cells. Here's the setup. When blood sugar runs high, extra glucose diffuses into tissues and mixes with sweat in warm, moist areas. Yeast loves that environment. That's why rashes show up in skin folds, under the breasts, the groin, and genital areas. You may notice redness, cottage cheese-like discharge, swelling, or a raw burning itch that flares after workouts or hot days. Over-the-counter creams often calm the itch for a week, but the cycle returns if sugar stays high. The surface improves, yet the fuel source remains. In people with type 2 diabetes or prediabetes, those flare-ups tend to come back faster and last longer, especially when clothes trap heat and moisture. Immune defenses can also run weaker with high sugars, adding to the risk. Research consistently links poor glycemic control with recurrent candidiasis. Moisture, friction, and thinner skin in older adults raise the risk further. If you use antibiotics or steroids, the balance tilts even more toward yeast overgrowth. Try a discreet at-home routine. After bathing, pat dry, then use a cool hairdryer on loafer folds. Wear breathable cotton underwear and change out of damp clothes quickly. Consider a gentle antifungal wash if advised by your clinician. Proper glucose control is key to preventing recurrences. Treat the itch, but address the fuel. Mini payoff: keep the area dry, choose loose, breathable fabrics, and check a glucose reading. If infections recur 4 or more times a year or don't clear in 7 to 10 days, see your clinician and ask to address A1C, then pay attention to what your skin is telling you in other places too. Lotion helps for an hour, then the itch returns. The real issue may be inside your blood, not your moisturizer. High blood sugar quietly dries the skin from within. Excess glucose pulls water out of tissues, lowers natural oil production, and slows tiny blood vessels that feed your skin. The result is tight, flaky patches, fine cracks, and itch that flares after hot showers or dry weather. Shins, elbows, and feet get hit hard because circulation there is already slower and the skin barrier is thinner. Skin changes like this are among the most common signs seen with diabetes, which is why they're worth noticing early. Scratching feels good for seconds, then backfires. Breaks in dry skin invite germs, and in older adults, those small splits on the legs and heels can turn into sore red spots that take weeks to settle. That's why catching dryness early matters. Diabetes-related skin issues often improve with steadier glucose and a simple, consistent routine. Right after bathing, pat dry and apply a thick emollient, think ointment or cream, not lotion, while the skin is still damp. Run a humidifier at night, keep showers warm, not hot, and trim nails to avoid breaks. Inspect skin daily, especially the feet and between toes, as part of routine diabetes care. Mini payoff: if dryness persists despite this routine or worsens, check your glucose and ask for labs and a care plan. But spotting these 10 warning signs is just the beginning. Now it's time to act, to bring your blood sugar down before more damage builds. The good news? A few powerful foods can help flush out excess glucose and protect your nerves, eyes, and kidneys. Tap the video on your screen now to discover the top 3 doctor-approved superfoods every diabetic should start using this week.